Well, Thursday marked 1 year since the WHO, the World Health Organization, declared coronavirus a global pandemic. Now, Thursday saw Rwandan President Paul Kagame and his wife Janet receive their Covid-19 vaccines as the country's inoculation rollout picks up pace. The presidents of Malawi and the Gambia also followed suit. Vaccine programs across the continent got off to a slow start, but more than half the continent's countries have now received shots. But it will take a concerted effort, time and money for Africa to get ahead of the pandemic. Kenya, one of the first East African countries to start vaccinating, has said it's already seen a third wave of infections. Our Mukelwa Hlatshwayo tells us more.
The first COVID-19 case in Africa was reported just over a year ago in Egypt. Within 3 months, the virus had spread all over the continent and countries were experiencing community transmission. The testing capacity was limited and it was believed that there was widespread underreporting. By the second week of June, Africa had reported over 200,000 cases, while Europe had recorded over 2 million cases. At the start of the pandemic, African governments enforced various lockdown measures to stop the spread of the virus. These included the mandatory wearing of masks in public, shutting down of schools, and the ban on all travel. In countries like Kenya, Uganda, and South Africa, the lockdown measures were enforced violently by police and people were injured and killed. Authorities had to deal with the toll that these measures put on communities. In Kenya, as in many other African countries, lockdown measures resulted in millions of people losing their livelihoods due to the economic downturn. So even though the reported rates of infection were lower, the economic consequences were severe. For instance, hundreds of thousands of households in Kenya ran out of food, and school closures meant that children could not access the school feeding programs. Towards the end of the year, governments such as Kenya started to ease lockdown measures and life returned to normalcy as international travel was allowed and people returned to work. Today, Kenya recorded the highest number of COVID-19 cases since last year. The Ministry of Health says that the country is officially in its third wave. More than half of the countries in Africa have received COVID-19 vaccines. Kenya received its first batch of over 1 million doses of the AstraZeneca Oxford vaccine several days ago. Vaccine programs have also started in other parts of the continent through the international COVAX program to help poor countries. Most countries will prioritize frontline workers.
The COVAX shipments continue at a rapid pace, and as of yesterday, almost 14.8 million doses have been delivered to 22 African countries. This is great news. 19 African countries have now started vaccination campaigns, and through COVAX, more than 518,000 doses have been administered.
Experts say that the vast majority of people living in poorer countries, many of those in Africa, will miss out on the vaccine this year. There have been calls by health rights groups, the government of South Africa and India, to suspend intellectual property rights in order for poorer countries to have access to vaccine patents so that the rollout can be more equal globally. Experts warn that the current inequality of the vaccine rollout will affect wealthier countries too. They say that as long as the virus continues to spread in other parts of the world, there is a risk of new COVID mutations against which the vaccines do not work.